Metals and alloys play a significant role in dentistry due to their desirable properties, such as strength, durability, biocompatibility, and corrosion resistance. They are commonly used for various dental applications, including dental restorations, orthodontic appliances, and dental implants. Here are some important metals and alloys used in dentistry. Gold alloys. Gold has been used in dentistry for centuries due to its excellent biocompatibility and durability. Gold alloys, which include a mixture of gold, silver, and other metals, are commonly used for dental crowns, bridges, inlays, and onlays. These alloys are easy to work with and can be cast into precise shapes. Titanium and titanium alloys. Titanium and its alloys are known for their exceptional biocompatibility and corrosion resistance. They are widely used for dental implants, which are artificial tooth roots that are surgically placed into the jawbone to support replacement teeth. Titanium implants integrate well with the bone tissue and provide a strong foundation for dental prosthetics. Stainless steel. Stainless steel is used in orthodontics for making brackets, wires, and other components of braces. It's corrosion resistant and provides the necessary strength for orthodontic appliances. Cobalt chromium alloys. These alloys are commonly used for making partial denture frameworks due to their strength, corrosion resistance, and biocompatibility. They are lighter than gold alloys and can be an economical alternative. Nickel chromium alloys. These alloys are used for making removable partial dentures and dental crowns. They offer good mechanical properties and are relatively easy to work with. Amalgam. Dental amalgam is a mixture of metals, primarily silver, tin, copper, and mercury. Despite some concerns about mercury toxicity, amalgam has been widely used for dental fillings due to its durability and ease of placement. However, its popularity has decreased in recent years due to the rise of tooth-colored alternatives. Porcelain-Fused-to-Metal, PFM. This is a type of dental crown or bridge where a metal framework is covered with porcelain. The metal provides strength and stability, while the porcelain layer provides a natural appearance. Zirconia. Zirconia is a ceramic material that is used for dental crowns, bridges, and implants. It is known for its strength, durability, and aesthetic qualities. Zirconia restorations can closely mimic the appearance of natural teeth. Noble metal alloys. Noble metals like gold, platinum, and palladium are often used in dental alloys due to their inert nature and biocompatibility. These metals are used in various combinations to create dental materials with desired properties. It's important to note that dental materials and technology continue to evolve, and newer materials with improved properties are being developed. The choice of metal or alloy depends on factors such as the specific dental application, patient preferences, and advances in materials science. Additionally, biocompatibility, aesthetics, and ease of use are critical considerations when selecting the appropriate material.